And I was struck when Jonas said Miss Out took charge. That's the Ministry for Education, Ministry for Health took charge. I think that's a key message and something that we wanted to make sure was exactly how the partnership worked. In terms of how is quality improvement, training people in quality improvement, why would that have any effect on workforce retention? I mean, we've big issues with workforce retention here in Ireland, and one of the things I think that we have discovered, and we've done a lot of research on it, is that it's not so much what people are paid or that affects people's desire to work somewhere. I think it's really people go in to do a job of work, and if they can get that job of work done satisfactorily and they feel they've done a good job, that's one of the biggest boosts that you can get to your morale as a worker. And I work still in the frontline services, so I feel that myself. And so we certainly find in Ireland that if we can create situations where people can be engaged themselves in improving care, that's what they go in to do in the first place anyway. That's clearly going to, I think, have a very positive impact on people's desire to continue working in that health system. Because it means, I think the quality improvement approach respects all forms of leadership. It's not just doctors who lead, it's not just nurses who lead. We've done work with portering staff, with catering staff, who've led initiatives in areas where they're the experts. So it recognises expertise in all its forms, and I think that has a big impact, I think, also on the whole concept of team working. And I think that helps create an environment which people want to come into work, and if there's less of a push factor to say, I can't hack it here anymore, I'm off. So I believe that's one of the reasons. And then you ask does the kind of way we work in Ireland, does it translate? Well, it needs to be translated. I mean, it's not that we think we have sorted things out in Ireland. We certainly haven't. You just need to go into one of our emergency departments. You'll see long waiting times for patients, things that would in some way shock you, I think, coming from other countries. So we're not going into this partnership with any sense that we have the answers, but we have worked a lot on developing methodologies for trying to tackle some of those difficult problems. And we've certainly found, and you've seen Jonas presented some of the really extraordinary improvements that our colleagues in Mozambique have achieved through adopting a method for change. I think historically, certainly in Ireland, we found something would go wrong in Ireland. We'd go and say, well, this is what went wrong, this is what needs to happen. I'd send a letter out to everybody and tell everybody to change. And nobody did, so surprise, surprise. So we've understood the importance of having a method, and I think sharing that method has had really extraordinary impacts in Mozambique. We've found the partnership as being with highly committed, highly intelligent people who have achieved things that take a long time to achieve in many other settings. So I think you can adapt it to the local context, yes, and it's had an amazing impact, really, in many ways.